is brucellosis. Brucella infection, rarely found it clinically. I never see. I seen in some articles that some guy having a brucellosis diagnosis at IPGME or what kind of thing. So, brucella infections happen, but this is a kind of infection very much undiagnosed. Okay, we don't know because the thing is that what mind doesn't know, I can't see. So, clinicians who practiced especially in rural area doesn't having enough mind that this patient having a brucella infection. This is a very fact because the presentation of this infection is a kind of fever and arthalgia. Arthalgia means joint pain, right? So, this is a kind of presentations of reactive arthritis. Reactive arthritis means any arthritis having a background of little bit of inflammations, right? It might be a UTI. Patient having a UTI presented with a very heavily joint pain, sudden onset, having a history of fever. This is a kind of reactive arthritis. Might be a kind of associated with STD. So, that's how reactive arthritis is presented. So, this is a scenario, brucella infections, patient come with it to your clinic with a polyarthalgia, mean multiple joint pain, having a fever, and the type of fever is a Malta fever or undulating fever. This is a kind of you have to accustomed with different grades, different types of fever in infectious disease. Okay, what are the various types of fever? So, this is a term I think you heard for the first time. This is what is the type of fever is called Malta fever or undulating fever. This is a kind of fever seen in only in brucellosis. This is the typical term stamp for what? Brucellosis. What is the typical stamp for malaria fever? Chills and rigor. If you have in a clinical scenario, questions came with a chills and rigor, profuse sweating. So, you can see or you can think about this is a malaria. If you are asked having a biphasic fever, biphasic fever is associated with anyone? Biphasic fever, dengue fever. Dengue fever is associated with biphasic fever, 2 peaks in a day, high grade fever, stop, another high grade fever. Another is a term called step ladder pattern. You already heard it? Typhoid. There is a fever type is called step ladder pattern, gradual rise of fever, 99, 100, 101, 102, 103, 104, then having a plateau, then gradual decline. This is called what? Step ladder pattern of fever. So, this is a various kind of fever. Another fever is called continuous fever. Fever doesn't subside, having a high grade of fever. Any kind of lobar pneumonia or any kind of initial viral infections, you having a high grade continuous fever. Another is called intermittent fever. Fever spikes down, whatever, any kind of infections having an intermittent fever depend upon patient's immunity, and it varies actually. Another is a remittent fever. Fever fluctuates but doesn't touch the normal level, and the fluctuations level always more than 1 degree centigrade, mean 102, 103, 102, 103, this kind of fluctuations, remittent fever. Another fever is called relapsing fever. Patient having a few days or episodes of fever, then it's become normal. Seems is very much normal, and patient after it came back. This is called relapsing fever. So, this is a kind of fever you have to accustomed with your throughout career. Continuous fever, intermittent fever, fever with chills and rigor, night fever with night grade of fever with sweating, night grade fever with sweating, tuberculosis, ठीक है, relapsing fever, and then stepladder pattern fever, remittent fever, and also today we heard about what? Undulating fever or Malta fever. So this is a kind of questions I will put you. Now first you, whatever the knowledge we gather, our main goal is what? Passing prof. That's right. So kind of first the importance of the brucella. Brucella is a, first I have told you that I have never seen a clinical cases in my life. Okay. So I had through the paper. So this is a kind of rarest disease. So brucellosis normally not found. So this is not that kind of important like TB, dengue, malaria. So you can be only asked or you can be only get only in theory exam, right? এটা ভাইভাতেও জিজ্ঞাসা জেনারেলি করবে না, করতে পারে একটাই কন্ডিশন, if you know about brucella is little bit good. So brucella is a oxidase positive. Now your practical, there is a one oxidase positive sample specimen. What is that? What is the name of the organisms you have been given? কি কোনটা কমনলি দেওয়া হয় অক্সিডেজ পজিটিভ? পাঁচটা তো অর্গানিজমস দেওয়া হয়। এবারে গ্রাম স্টেন করলে তো কি কি ছিল? আরে বল, স্ট্যাফাইলোকক্কাস অরিয়াস, নেক্সট স্টেপটোকক্কাস ছিল প্র্যাকটিক্যালে, একদম স্টেপটোকক্কাস প্র্যাকটিক্যালে ছিল, ওই জন্য প্র্যাকটিক্যালে কম পেয়েছিস। হ্যাঁ, সিউডোমোনাস না। I want to know the 5 bacteria names which are given in practical for the gram stain unknown bacteria. What are those 5s? What are those 5s? বল কি কি ছিল এবারে এক্সামে? ক্লেপসিয়েলা ছিল, রাইট, স্ট্যাফাইলোকক্কাস ছিল, আর ইকোলাই ছিল, আর কি 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 নিজেরিয়া ছিল, প্র্যাকটিক্যালি নিজেরিয়া ছিল। এটা পেটা ওকে, গনোরিয়া ছিল না প্র্যাকটিক্যালে। আমি আননোন ব্যাকটেরিয়া বলছি, 5টা ব্যাকটেরিয়া ছিল, কি কি? ইকোলাই, স্ট্যাফ, ক্লেপসিয়েলা, আর দুটো এনএলএফ, 2 LF ল্যাকটোজ ফার্মেন্টিং, 1 is ক্লেপসিয়েলা, 1 is ইকোলাই, একটা ছিল গ্রাম পজিটিভ স্ট্যাফ অরিয়াস, আরো দুটো ব্যাকটেরিয়া ছিল, কি কি? প্রোটিয়াস, দ্যাট ইজ এনএলএফ নন ল্যাকটোজ ফার্মেন্টিং, এন্ড লাস্ট নন ল্যাকটোজ ফার্মেন্টিং অলরেডি একজন বলেছে, সিউডোমোনাস। সো দিস আর দ্য 5 ব্যাকটেরিয়া প্র্যাকটিক্যালে কমনলি দেওয়া হয়। ঠিক আছে, এখনো তোমরা নামগুলো বলতে পারছো না, তাহলে পরীক্ষায় কি বলবে? ঠিক আছে, ওখানে ABCD করে দেওয়া থাকে, তোমাদের ভাগ্যে বা যার যেটা পড়বে। গট মাই পয়েন্ট? সো দিস আর দ্য 5 ব্যাকটেরিয়া you have to go through well. So one of the bacteria is Pseudomonas. Pseudomonas is oxidase positive. ঠিক আছে, সো যদি কারো সিউডোমোনাস নিয়ে এরকম আমাদের হয় যে সেটাকে নিয়ে তোমার সিউডোমোনাস পড়েছে, তুমি ভাইভাতে গেলে, তুমি বললে বলো সিউডোমোনাস কি করে বুঝবে? অক্সিডেজ পজিটিভ। তখন ইউ ক্যান বি আস্কড what are the others bacteria are oxidase positive, let me know. ঠিক আছে, then you have to drag the examiner to your domain. There's a brucella. Brucella, বাহ, বলো তাহলে ব্রুসেলা কি করে, then you can be asked in viva. Otherwise brucellosis direct come to your prof as a what? Theory questions. Okay, so এই ব্রুসেলা নিয়ে আমরা খুব অল্প জানবো, বিশাল হাইফাই কিছু জানবো না। The kind of clinical presentation, the kind of little bit of biochemicals যেটা অলরেডি বললাম, oxidase positive is important part, and another importance lab diagnosis, culture media কিরকম দেখতে, Gram-strain morphology and other little bit of serology test. Done. Brucella niye beshi kichu ar amra janbo na. Because there are lots of things you have to know well. You have to know very well regarding tuberculosis. You have to you have to know very well regarding malaria. Lots of things ekdom jekhane tomake gule khete hobe. Tole jetuku dorkar shetukui janbo, olpo janbo. Okay, fine. So let's start. So a group of patients come of rural area present to your clinic with a history of undulating fever. So already discussed what is undulating fever. Arthalgia, fatigue, night sweats for the past few weeks. On further questioning, they report the regular consumption of unpasteurized milk. So this is another catchy thing, unpasteurized milk. Because brucella is a zoonotic disease. What is zoonotic disease? Huh? Kind of thing. So there is a relationship between animal and human. This spread from the directly, zoonotic disease means from animals. So dairy products from the local farm, and given their symptoms of exposure and history, what are the common clinical manifestations of brucellosis and how it can be differentiated from other febrile illness such as malaria, typhoid and tuberculosis. So we already discussed it, how can we be differentiated. So it can be differentiated initially by questioning fever pattern, right. So typhoid having a stepladder pattern, TB having a night gate of fever with a sweating, malaria having a chills of rigor. It is an intermittent fever, and if you categorize that intermittent fever of malaria, it can be three types: quotidian and one is a tertian, and one is a tertian mean 48 hours interval fever, and is a quotidian mean 24 hours, and another is a 72 hours. So these are three types of malaria fever. So it will be discussed when we taught malaria, right. Now this is the kind of manifestations of brucella: fever, musculoskeletal system, arthalgia, GI, nausea, vomiting, hepatosplenomegaly, neurological symptoms. Patient might having a headache, might having a depressions in severe cases, and also the neurobrucellosis, meningitis, and hematologic symptoms: anemia, leukopenia and thrombocytopenia. So this is the kind of symptoms we can get, and these are very commonest pictures of any fever. Okay. So difference from the other febrile illness, yes, malaria having a cyclic fever pattern, chills and rigor. Typhoid, it doesn't typically present with rose spots, right. So typhoid present with rose spots, strawberry tongue we can get, and it is a stepladder pattern. Tuberculosis, significant lung involvement is there. Any kind of TB, you have to ask one thing: do you have a cough? Because pulmonary TB is one of the commonest TB. We have already discussed regarding pulmonary TB, but thing is that most common form of the TB is a pulmonary TB in India still now. History of weight loss and night gate of fever. So this is a kind of other things you have to know. And patient is like, hi sir, I have a brucellosis, give me a doxycycline, right. So patient come with a babu amar na bishal jor, se ekta tar jor ache nao ache tao bolbe, adbhut presentations, right. So you have to know very well. So first described by David Bruce in the Malta soldiers. Why this is called Malta fever? This is called the Malta soldiers in a British physician 1887 when isolated brucella meliensis from the spleens of British soldiers who suffered from a febrile illness on the islands of Malta. That's why it is called Malta fever. Then it is found also in cattle, right. It's found in cattle by Bernhard Bang, that is Brucella abortus, and remains is a major zoonotic disease. It is transmitted from cattle to human transmissions is very rare. So entry Brucella enters through our body through the mucosal surface. It can be by injections like unpasteurized milk or skin abrasions, intracellular surviving, and Brucella survive into the macrophages, preventing phagolysosome fusions, disseminations, and after the brucella spread via lymphatics and bloods invades other organ, liver, spleen and bone marrow, and granuloma formations. Chronic infections leads to granulomatous inflammations, tissue necrosis and fibrosis in severe organs. So this is all about pathophysiology. And clinical symptoms we can be categorized into two parts. One is a general symptoms and another is a organ specific symptoms. The general symptoms of the brucella is more or less common like any other fevers, having a high grade of fever, kind of undulating type first of all. Second, that fever, apart from fever, most is the important feature is the arthalgia. That patients having what? Arthalgia mane ki re? Ghum pacche? Joint pain, right. So any fever having a arthalgia, many fever, profuse sweating, fatigue, malaise, weakness, weight loss and anorexia. This is the general symptoms. Now the organ specific symptoms. Now already we discussed musculoskeletal, neurological, hepatosplenic, hepatosplenomegaly and jaundice, because that brucella invades where? Various organs, তাই তো? এবার যদি spleen and liver getting involved, then what we can get? Jaundice, right? So jaundice is very common manifestations. Endocarditis, GI, gastrointestinal, nausea, vomiting, diarrhea and genitourinary orchitis, epididymitis, spontaneous abortion. So this is a kind of organ specific symptoms. Now mode of transmission, direct contact, handling infected animals, tissues, blood, secretions. So this is a commonly found in veterinarian, right? All the veterinary doctors and kind of those are dealing with veterinaries, slaughterhouse workers, farmers, having a more chances to get these infections. Ingestions, consumption of the unpasteurized dairy product, milk, cheesy, butter from infected animals. Inhalations, aerosol transmissions in laboratory workers. Congenital transmissions is rare but possible, and person to person transmission is extremely rare. So mainly we can get that from zoonotic disease, those are highly dealing with infected animals. And what are the samples we have to collect? Blood cultures is the most common methods. Bone marrow aspirations, gold standard for detecting chronic cases. CSF for subsisted neurobrucellosis. Synovial fluid for arthritis related brucellosis. Liver biopsy in case of hepatosplenic involvement. And urine and semen occasionally used for genitourinary infection. It depends which kind of fever and which kind of organ involved, then as per the organ involvement we will take the samples, right? Suppose tomar karo brucella, tumi eta positive পেয়েছো IgM. Now patient having a very what? Low sensorium. তাহলে you suspect a neurobrucellosis. মানে একটা পেশেন্ট এমনি নরমাল ঘোরাফেরা করছে, তার জ্বর আছে, ব্রুসেলা এলে তার কি সিএসএফ টানবো? টানবো না। আমি কখন টানবো? যখন আমার পেশেন্টের যেই সিমটমটা থাকবে, তাই না? আমার পেশেন্টের যদি সিমটমস থাকে, পেশেন্ট খুব অল্টার্ড সেন্সোরিয়াম, তার সেন্স ভালো নেই, তোমার একটা ব্রুসেলা আইজিএম পজিটিভ এসছে, তাহলে তুমি চাও ঠিক আছে আমি এবারে ব্রুসেলার কালচার করব, তখনই আমি সিএসএফ স্যাম্পল নেব, আদারওয়াইজ নট যে আরে বাবা এলো মানে আমি এতগুলো স্যাম্পল নিয়ে নিলাম। নো, অ্যাজ পার পেশেন্ট সিমটমস উইল টেক দ্য স্যাম্পল। So this is the sample we have to take. Now ground stain Brucella sp are the gram negative bacteria. They appear in small coccobacilli and short rods, often occurring single or pairs. They are non-motile, non-spore forming and non-capsulated. The bacteria may show bipolar staining and are difficult to visualize due to their small size. So basically you have to know regarding Brucella, it is a gram negative bacteria having a coccobacilli and non-motile and non-spore forming. Now at lab you have to identify it, and how can we culture? This is a culture is a gold standard. So first we have to select a proper culture media. If you suspecting Brucella, so Brucella is a fastidious organism. So which is fastidious? What is fastidious means? Normally basal media who doesn't grow. If you wanna complete it, a basal media, what is a basal media? Give an example. Nutrient agar. Nutrient agar is a basal media. Okay. So basal media যেটা normally grow করে না, সেখানে আমার তাকে আমরা বলছি fastidious, and it doesn't grow rapidly. Rapidly mean within 24 to 24 hours, 48 hours এ আমরা যাকে growth পাচ্ছি না। So that is a non-fastidious organism, and fastidious organism who doesn't grow on basal media. But fastidious organisms need some special treatments, তাদের একটু বেশি ভালোবাসা দরকার, তার জন্য কি দরকার? They need enriched media. What is the enriched media here? Blood agar, chocolates agar, right? So there are some others media also, Brucella agar, Tripticase soy agar, Castanida biphasic medium. These are the all a kind of what? Enriched media. You remember any two, blood agar, chocolate agar, that's good, that's enough. পৃথিবীর সবকিছু মনে রাখতে হবে এরকম কোনো কথা নেই। So good growth and smooth glistening colony, hemolytic, non-hemolytic colony. Chocolate agar provides essential nutrients used enhance recovery. Brucella agar enriched media specifically designed for Brucella isolation. So these are the all medias, and these are some of the selective media. And selective media, we know the role of selective media of Brucella is only support growth of Brucella. Other bacteria doesn't grow at that part. Amar blood agar e ajke sob kichu grow korbe because it is a enriched media, but selective media having a only property to grow particular organisms. Hey, at a selective media example bol LJ media আর LJ media কি গ্রো করে? কি? Microbacterium tuberculosis, full form of LJ media, right? Another example of selective media. Have you heard about McConkey agar? ভাই ওটা বলিস নালে ফেল করে যাবে। হ্যাঁ ওটা জানিস, শুনেছিস তো, তা বলছিস না কেন? এই তোর পাশে কানে হেডফোন দিয়ে আছে, ঘুমাচ্ছে, ডাক ডাক তোর পাশে, কানে হেডফোন, তোকে বলছি আরে হেডফোনটা খোল তবে তো শুনতে পাবি। হ্যাঁ হেডফোন খুলেছিস? McConkey agar, what are the others apart from selective media? McConkey agar কে আর কি কি বলে? McConkey agar is a what? কি? McConkey agar is a selective media or not? Huh? Selective media. Why it is called selective media? And there are the two others name of McConkey, others property of McConkey basically. হাজার বার বলেছি। So back to selective media of Brucella, ठीक है? One is a aste modified Thermatin media and another is a Ferrell's media, right? একটা জানলেই হবে, that's it. Now blood culture technique. So this is a fastidious organism, need time, aste aste. This is a fastidious organism, needs time to grow, that's why it is a slow growth rate, 2 to 6 weeks, required a prolonged incubations. And in automated blood cultures, increased detection efficiency. Now apart from conventional blood culture technique, there is a automated system, right? কি নাম সেটার? ব্যাকটেক or BacT-alert. এখানে কি আমাকে আলাদা করে কিছু দিতে হয় না, সিলেকশনস লাগে না। অলরেডি দিস ইজ এ কাইন্ড অফ এনরিচড মিডিয়া। আমরা ব্লাড স্যাম্পলসটা সেখানে পুট করে উই ইনকিউবেট ভায়া অটোমেটেড সিস্টেম। ওকে, যখনই একটা সার্টেন লেভেল অফ গ্রোথ অফ ব্যাকটেরিয়া হ্যাপেন্স, দেন pH চেঞ্জেস। যেই pH চেঞ্জ হয়, কালার চেঞ্জেস হ্যাপেন টু দ্য মিডিয়ার bottom end and machine sense it and they signal it, okay fine, this bottle now considered as a positive, you inoculate it, আমরা ওটাকে বার করে further we have to inoculate it, right? So this is how automated system works. So BacT-alert, BacTech, blood culture you can incorporate to your notes anywhere, সব জায়গাতেই এটা তুমি দিয়ে এইভাবে লিখতে পারো, ঠিক আছে? এই যে পয়েন্টটা সমস্ত ব্যাকটেরিয়ার ল্যাব ডায়াগনোসিস ইউ ক্যান রাইট ইট automated system. This is a catchy point you have to know very well because you can lengthening your answer script. আচ্ছা, কার্বন ডাইঅক্সাইড enrichment conditions যদি আমরা এটা প্রোভাইড করতে পারি, little bit of capnophilic environment, incubations at 30-70 degrees are optimum for growth. Now this is a small smooth convex translucent colony on blood agar. Older culture may develop rough and it is a non-hemolytic colony. That's it. And most important for two part oxidase and catalase eto kichu janbo na, urea strongly positive and oxidase is positive. This is the important biochemical reactions you have to know. Last, some serological diagnosis. As we know, brucella is difficult to culture. So if you suspect brucella, you just put out the blood from the patients and you do some serological test. Serological test easily available, serological test easy to perform. So first is some agglutinations test. This is a Rose Bengal test. Rose Bengal test means you just put the samples of brucella and put some antibody to it. It detects, and if blood contains antigen, there is agglutinations occur and you can diagnose is a brucella positive. This is a Rose Bengal test, rapid screening test for brucellosis. এটা যখন বিভিন্ন জায়গায় যাওয়া হয় ক্যাটেল শিপস খামারে, তখন এই টেস্টটা করা হয়। Serum agglutination test detects anti-brucella antibodies titer 1:160 positive. ELISA is a more sensitive and specific for detecting IgM and IgG, IgM for acute brucella, IgG for chronic. And lastly PCR, and PCR পৃথিবীর সব জায়গায় সবকিছু ডায়াগনোস করতে পারে। So this is another option. So these are the serological test, you have to write it. One is a Rose Bengal test, one is a SAT, and another is a ELISA, IgG, IgM. And differential diagnosis of brucella, brucella হয়ে গেছে। Brucella must be differentiated from Franciscian, Bordetella, Pasturella and Haemophilus based on biochemical reactions because all are fastidious organisms. Unlike Haemophilus, Brucella does not require factor 10 and factor 5. Haemophilus পড়ানো হয়েছে তো? পড়ানো হয়নি? হ্যাঁ? আমি পড়েছিলাম তো। স্যাটেলাইটিজম পড়ানো হয়েছিল না? So Haemophilus need factor 10 and factor 5 where Brucella doesn't. Now the treatment, doxycycline and rifampicin. There is very much regimen for Brucella treatment. Just know about doxycycline and rifampicin combinations. That's it. Chalo, so this is all about Brucella. Brucella is not that kind of heavy topic. Just you have to know this is a fastidious organisms. And this is a zoonotic disease. This is a oxidase zoonotic disease. It spreads. Those are mainly walk-in cattle with veterinarian people, right? Acha. Next, it is a gram-negative bacteria, non-motile, non-spore forming, and for these isolations need a little bit enriched media, blood agar, chocolate agar, or thermatin media. And it is a non-hemolytic colony, and most important part of Brucella is a oxidase positive, catalase positive, oxidase positive, and treatment is what? Doxycycline along with rifampicin. That's it. So this is all the summary of Brucella. এইটুকুনি জানলেই হবে, ঠিক আছে? চলো। So it's a significant zoonotic disease, requires early diagnosis and appropriate antibiotic therapy to prevent complications. Preventive measures include vaccinations of livestock, pasteurizations of dairy products, proper protective measures for high-risk workers since the disease can have a chronic and relapsing form. Long-term follow-up of the patient is crucial, right? So, thank you.